Good afternoon, everyone. We'll get today's briefing started. We'll be hearing from Mayor Tom Barrett, Milwaukee County Executive David Crowley, Dr. Ben Weston, Associate Professor with the Medical College of Wisconsin and Director of Medical Services for the Office of Emergency Management, and Darren Rausch, Health Officer and Director with the Greenfield Health Department. Mayor Barrett, I'll hand things over to you to get us started today.
Thank you very much, Catherine. Good afternoon, everyone. Well, in our continuing efforts to try to disseminate as much information as quickly as possible and to as many people as possible, last night we had a really successful COVID-19 vaccine town hall meeting with local experts, including our Commissioner Jackson. Dr. Parity was on the call. Julia Means from Ascension was on the call. And we were able to really talk to a lot of people, probably around 2,000 people through Zoom and Facebook were able to experience this. And what I was particularly pleased by is that we were able to answer participant questions in real time. We had a chat box, we had question and answer, and there were lots and lots of questions, as you might imagine. And having the medical experts there to answer those questions, I think was very, very beneficial. I'd say probably the area of the biggest concern for people who left the call, maybe dissatisfied or unsatisfied through no fault of our own, is there's still clearly a real thirst for more knowledge as to when individuals will be eligible for the vaccination. And as we've talked about this in the past, but I think it bears repeating. There are several layers to the decision-making process. First, coming out of the federal government, you've got the Center for Disease Control, which has set some parameters as to who should be in which category. It then goes to the states, and each state has some flexibility as to what it will do in terms of setting the criteria for the next groups. Right now we are in 1A, but we are in 1A with the addition of police officers and firefighters and others. In addition to this, beginning March 1st, we'll be able to be doing some vaccination of teachers, of some essential workers. And as we all know, over the last couple of weeks, those who are 65 and older have been permitted to get their vaccinations as well. But as we've also said repeatedly, eligibility does not equate to having availability. And that is clearly an issue that we are facing here in Milwaukee. It's an issue we're facing throughout the state of Wisconsin and throughout this nation, that the demand for the vaccination far outstrips the supply that we have. And so what we are continuing to do here is to make the case for more vaccines for the city of Milwaukee and for the surrounding areas. I know the suburban mayors are concerned about this, but I think people are concerned about it everywhere. Everybody wants to have more vaccines right now. And that's a good thing, because we also know that there is a considerable number, not a majority certainly, but a considerable number of people who do not want to get the vaccine. And in order for the vaccine to be as effective as possible, we want to move towards that herd situation where lots and lots of people, a high percentage of people have the vaccination. So that was one of the other things that we dealt with last night in the call, was some of the myths that are out there as to whether people should or should not get the vaccine. But the overriding and overwhelming medical consensus is to get the vaccine if you're eligible. And again, what we're going to do is we're going to continue to fight to get as many doses here so that more and more people can get the vaccination. And what was especially encouraging to see last night was that we polled our participants at the beginning and at the end of the town hall and found that after listening to what our health experts had to say, a very, very high percentage of people were very likely to get the vaccine. So I think once people listen to the medical experts, once they get the information, and we know there's a lot of questions, and we all have a lot of questions, and we're trying to deal with them as fast as we can. But if you were unable to join us last night, you can still watch the full recording online at milwaukee.gov/health. So please make the time to learn the facts and make the best decisions for yourself and your family. And clearly one of those decisions that is a timely decision is always the testing issue. And as Dr. Weston will report, we are headed in sort of the wrong direction on testing, but the right direction in terms of percent positivity. And what I mean by that, fewer people have been getting the test over the last several months, and that's not good. But we're also seeing is a drop in those who are getting the test, who are testing positive. And that's very, very encouraging news. But we continue to have our community sites. The site at American Family yesterday tested 550 people. That's at the ballpark. Note that the Northwest and Southside Health Center sites have transitioned to the curative mobile team, and those current hours are 9 a.m. to 2 p.m. Monday through Saturday. And yesterday we had 145 people at the Northwest Side Health Center, but only 75 on the Southside Health Center. So we have got a lot more capacity. So if you are feeling symptoms or if you have been exposed to someone, I can say this over and over again, but it's important. It does not take long to get this test. And it's a very, very important test for people to take. So a reminder that our community testing locations are free and they're very fast. So please take advantage of this testing if you're symptomatic or you think you might have been exposed to someone who has tested positive. So we continue to get the word out. I want people to know that the tests are available for children 1 year and older. So we have the capacity to do very, very young kids, and that's something very, very important. And if you're looking for more testing locations, you can always go to testupmke.com, and that'll give you testing locations throughout the entire county of Milwaukee. So we're doing everything we can to get as many vaccines here, to do the tracing, do the testing. Those are all very, very important. So with that, I'll turn it over to County Executive Crowley.
Well, thank you so much, Mayor Barrett. And first, I want to start off with some good news and give you all an update on the progress that we have been making as it relates to vaccinating state-eligible Milwaukee County employees. So as of yesterday, Milwaukee County's vaccination site has provided more than 1,200 people with the first dose of the Moderna vaccine, and 360 folks have received their second dose. And these are folks who primarily are emergency medical service personnel, law enforcement partners, behavioral health division staff, and other health and human service workers, among other groups related to within the phases 1A and 1B. And our Office of Emergency Management, or EMS team, is committed to not letting any vaccine go to waste. And to date, that has been very successful. So at this time, the county site, like others in the region, this is not a public site. This is not a public walk-up vaccination site. And while Milwaukee County, we do not have a health department, we do have the infrastructure through our Office of Emergency Management to continue these vaccinations as we receive doses from the state, but also the ability to add capacity should the vaccine supply become available. So we're staying true to Milwaukee County's commitment to equity. Our vaccination site next will focus to target state-eligible populations in partnership with the Division of Aging, as well as the Department of Health and Human Services, so we can reach some of our most underserved communities and our most vulnerable individuals throughout Milwaukee County. And as part of this strategy, we're working to obtain data to better understand and address the inequities in the vaccine distribution process. And we are going to continue to support local health departments in standing up community vaccination sites when needed to create broader access as supplies become available. And so switching gears, I also want to talk about the unprecedented strain that COVID-19 has had on local governments, particularly our budgets. And so in Wisconsin, counties have been more engaged in delivering COVID-related services. And in turn, we have been more negatively impacted by the pandemic than other counties in other states. And so Wisconsin counties, we are in a very unique position as we are required to provide local and state services with significant restrictions on the limited tools to really fund those services. So our role, coupled with the limited funding flexibility, has resulted in a disproportionate impact on Wisconsin counties. And so this week, the House Committee on Oversight and Reform released its fiscal year 2021 Reconciliation Act bill, which includes the coronavirus state and local fiscal recovery funds. And these funds will provide up to $350 billion to help states, counties, cities, as well as tribal governments cover increased expenses, replenish our lost revenue, but also help us mitigate the economic harm from this pandemic. And the measure provides roughly $130 billion to local governments, which split evenly between municipalities and counties, resulting in direct county allocation of about $65.1 billion. And this is a much needed bill because this recognizes the vital frontline role of America's counties in mitigating and really ending the COVID-19 pandemic. So this is a significant step in addressing the urgent needs of our nation's county governments as we continue to provide the essential services to more than 1 million residents here in Milwaukee County. And with that being said, we're looking at a fiscal impact from COVID that could exceed about $150 million. So we anticipate additional costs necessary to address these various challenges from the pandemic. And this includes immediate life-saving measures like PPE, sanitation, IT, or changes to physical spaces in our county buildings, or as it relates to mitigation, when you think about our Unified Emergency Operations Center, our hazard pay, the healthcare costs, as well as public safety, but also the economic and public health. We want to make sure that we have the ability to provide small businesses grants, continue the eviction prevention program, mortgage assistance, as well as food support. So we also expect substantial expenses from not just testing, but also our vaccination costs as well, especially as the spike for increased social services for our residents. We believe that's going to increase. And so while we have these increased expenses, our ability to pay for these increased costs has plummeted due to the economic challenges caused by this pandemic. And this includes property tax revenue, program revenue, as well as sales tax. And when you think about the entire dollar amount that we received, the $77 million that was allocated to Milwaukee County through the CARES Act funding, roughly $9 million remains in our account. But those funds have already been claimed by costs that we've already incurred. So without the flexibility to make up for the lost revenue, this assistance will help us close that gap. And so the direct allocation of the funds to counties is effective, but it's also efficient. And we can cut through the bureaucratic delays and tap into our local partnerships to get support out to our residents as quickly as possible, but also in both a responsible and transparent measure. So I'm very hopeful that this bill will pass through the committee and in the House, and so before the end of this month. And so I'm excited about that, but we'll see what happens. But with that, I'd like to turn it over to Dr. Weston.
All right, thank you, Mr. County Executive. Good afternoon. First, to our numbers, we have had 96,325 confirmed cases of COVID-19 in our community and 1,037 individuals who've died in Milwaukee County. We did receive another week of vaccine data from Milwaukee County and are seeing some slow but steady progress. A total of 97,402 doses of vaccine have now been administered in Milwaukee County. Average daily vaccinations have increased by about 20% since last week. And we also saw a promising jump in the 65 and older population, with nearly 14,000 new doses to that specific group. From an equity standpoint, there have been mild improvements, but certainly still an area of major concern. There was also a new CDC update yesterday with respect to the need to quarantine with the vaccine. As a reminder, quarantine is separating yourself from others after an exposure to someone with COVID-19. And the CDC yesterday stated that those who are fully vaccinated and 3 weeks out from that second dose of the vaccine, long enough for full immunity to build up, no longer have to quarantine after exposure, provided that they have no symptoms. So what that means is once you're 3 weeks out from being vaccinated, fully vaccinated, if you have an accidental exposure to someone with COVID-19, if you have no symptoms, you no longer need to quarantine by CDC guidelines. And as a reminder, after the vaccine, you do still need to mask and physically distance. That said, I think this is an exciting development and a sign of what will come with the vaccine and the excellent protection that it seems to provide from COVID. For our overall trends, we continue to see promising decreases with respect to cases, hospitalizations, and percent positivity. This is good and shows that individual behaviors work to drive down our disease burden. However, among the many things that we've learned about COVID over the last 10 months, chief among them has been the cycle in our disease burden. As our cases rise, we become more vigilant, individually as well as institutionally. We wear masks more, we distance more, we avoid large gatherings, and we seek out testing. And in large part because of these actions, we drive cases back down and we arrive where we are today with a lower disease burden. But then we've seen time and time again, the cycle shifts. Individually and institutionally, our very understandable COVID fatigue sets in. We pull back on precautions, we let down our guard, and cases in turn began to rise. We're most certainly at risk of that happening in the next 1 to 2 months. And if the spike that comes there arrives along with the rapidly spreading variant from the UK, with 70% contagiousness and 35% increased deadliness, we could be in for a spike like we've never experienced before. But the difference is we now have a new tool at our disposal, the vaccines. And the faster that we can get our population vaccinated, the more we can blunt this coming spike in cases. The UK variant is spreading, and our numbers, while trending well now, set us up for that drop in vigilance and that increase in cases. So what can we do about this? Well, on our end, we'll continue to advocate for vaccine allocations to our community and continue to get vaccine into the arms of our key populations as quickly as possible. And on your end, now is the critical time, as critical a time as ever, for you to continue precautions, as frustrating as that is with light at the end of the tunnel, to mask, to distance, and to avoid gatherings just for a short time more. These warning signs, a nadir in disease burden, a rapidly spreading new variant, and a modest vaccine rollout mean that we're on a critical timeline. The clock is ticking. Can we vaccinate enough people to blunt an impending spike in cases? And can the public mask, distance, and get tested to slow the spread of disease, and for that matter, slow the spread of these new variants in our state? While I'm worried, I think that, and I hope that we can do this. I'm hopeful that vaccine supply will increase, and I'm hopeful that we can buckle down for just a few more months and allow our community to get vaccinated to avoid another major devastating spike. Thank you very much. Stay safe, and I'll hand it to Director Rausch.
Hello and welcome, everyone. It's my pleasure to join today. My name is Darren Rausch from the City of Greenfield Health Department. Before I get into the data this week, I just kind of want to start talking about some overarching themes that we'll see in the data momentarily. As is mentioned by other members on this media briefing, the data continues to support a slow and steady decrease in COVID-19 cases countywide. Yet our rates remain high and we can't take our foot off the gas pedal of mitigations related to COVID-19. The slow and steady decrease is also consistent among our children population as well, and we'll see that momentarily. So let's go ahead and take a look at the data for this week. So the figure before you is looking at new cases of COVID disease in our community, and you can see a continued decrease really since a spike here a couple weeks after the holidays in both the city of Milwaukee and in the suburban communities. We see a very similar trend as we switch now to our data looking at children under the age of 18. Last week, we demonstrated a kind of a little increase, a little blip in the city of Milwaukee for kids, but now that has now decreased very similar to the suburban population. So looking back at our county-wide population, we continue to track deaths, and we certainly saw a huge spike of deaths several months back. And right now, we continue to have a pretty static level of deaths on any given day, averaging probably 2 to 4 deaths county-wide. And it's something that we continue to monitor very, very carefully. I will go next to talking about the reproductive number. This is the transmission rate number, and certainly we want to make sure that this number is below 1. We want to make sure we're suppressing disease, and a number below 1 means that less people are getting infected from the first individual who gets infected. So right now that number countywide is running about 0.96, but you see there's a little bit of variation and a little bit of an upward trend, and that's something we're going to watch very, very carefully. When we compare both the city of Milwaukee on the top and the county on the bottom, we see that the counties in the suburban part of the county has already approached 1. And so that's something we're going to be very, very careful and closely monitoring in the coming weeks. We've talked about testing, and certainly one of our messages for many, many weeks has been that testing is available if you need to access it. And that's the same story I want to show with this data here. It's very exciting to see our percent positives decrease. It's very exciting to see our 14-day trend heading in a negative direction, because that's really good. But we know there's still disease out there, and we know there may be people who need to be tested. So we certainly would encourage you to get testing at one of the sites throughout the county. Overall, our testing over the last about 6 weeks is about nearly half that of our peak for testing back in November. So we certainly know there's lots of capacity. And I'll leave you today with just a last map looking at where COVID cases have happened throughout the pandemic. On this map, looking and seeing the areas on this heat map that are red and orange being very indicative of having more cases. And certainly we still map the same thing over the last week. The number of cases are down, but certainly we can see on this heat map, there's still areas of concern where cases are higher than other parts of the county. So lastly, I want to finish today talking about a couple questions that are very, very frequently asked of local health departments, and I also see them raised and addressed in social media and on websites and other community forums. And that's by talking about the 2 V's, vaccine variants and COVID-19 vaccine itself. As we've said previously, all viruses mutate, and what we're seeing with COVID-19 mutations is no different than what we see annually with influenza virus. Wisconsin and other states across the country are having many COVID-19 specimens tested to determine the variants as it relates to mutations that are being experienced. This process permits the ability to track those variants and to track mutations over time. And it is really an important part of the surveillance process in looking for those variants. This is precisely how the new variant that was identified in Waukesha County, and it was released in the media earlier this week, was found. It was one of many specimens that was looked at and tested to determine if it was a variant. As Dr. Weston has mentioned, we have the tools, and we need to remember to continue to use those tools to prevent COVID-19 disease, whether we have variants or not in our community. And these mitigation strategies are really categorized by what you can do as a person and by what we can do collectively as society. And I would like to share one more graphic because I think it's very important as we talk about mitigation strategies and using multiple layers to achieve success in suppressing disease. So I have shared this before on media, and this is what is kind of called the Swiss cheese respiratory pandemic defense. And you can see that under personal responsibilities, these first 5 layers of Swiss cheese are things like staying home if you're sick, hand hygiene, wearing masks, avoid touching your face, limiting your time with other people. These are things that you can do as an individual. Collectively, as a society, we have shared responsibilities in looking and accessing testing, accessing robust contact tracing and disease investigation. Things like increasing indoor air filtration or taking meetings physically distant or via Zoom, ways that we can decrease the rate of disease in our community. Strong government messaging and public health education campaigns is an important part of this. Isolation and quarantine is another important strategy. And then lastly is vaccines. So if you visualize this as 9 different levels of Swiss cheese, the more layers together, the more likely we are to plug those holes and provide a more robust mitigation strategy for COVID-19. Certainly, we know on the vaccine front, there are 2 licensed vaccines from Pfizer and Moderna. They've been proven effective and safe. While the performance of that vaccine depends a little bit on the variants that are circulating, we still expect those vaccines to be very, very effective. And we do anticipate additional vaccines coming online. As has been mentioned previously on this briefing, we know that eligible for vaccine does not mean that vaccine is available for you. And that's still a very unfortunate truth to the ongoing vaccine rollout. As a state, Wisconsin continues to receive far too few vaccines for the demand that we have in our community. And that's the same story we can tell here in Milwaukee County. We're hopeful for additional vaccines in the coming weeks. And while we wait for additional vaccines to come into our communities, we know that additional community vaccinators are starting to get doses as well. Earlier this afternoon on the state media briefing, they talked about Walgreens coming online, and many Walgreens locations will be getting doses in and throughout Milwaukee County. These vaccinators, Walgreens, other small pharmacies, healthcare systems, medical clinics, are helpful to getting more doses into the community and more shots into arms as we try to attack this pandemic. Lastly, today, the Department of Health Services released some data related to statewide COVID-19 vaccination efforts. This data was first made available today on their website. And it shows some promising data. It's great to start to see some of the data that we're having an impact in our vaccination efforts. The site shows that 11% of the statewide population have received at least one dose. And at nearly 3.5% of the state's overall population that is eligible for vaccine has completed the series. These are baby steps, folks, but it's good that we're making these strides. In Milwaukee County, unfortunately, due to the small allocations and our large population, our numbers aren't as high. We have 8.5%, almost 8.5% of folks in Milwaukee County have received one dose, and 2.7% have received both doses. Again, the data is not as strong because the allocations coming into the county compared to the county's population are not as equitable or equal as we've talked about before. We're excited because the focus on 65 plus shows that almost more than a third statewide of those 65 years and older have received their vaccine. That number's a little bit lower in Milwaukee County. It's about 26.4%, but it is showing that we are getting shots into arms very successfully throughout Milwaukee County and the state. With small allocations, we certainly expect our numbers to be a little bit low now, but hopefully as more doses come into Milwaukee County and more vaccinators come on board, we will continue to see those numbers rise and closing that gap between the statewide numbers and Milwaukee County. Thank you all for your time and attention, and I'll turn the briefing back over to Catherine.
Thank you, Director Rausch. Our first question is from Sharon Bragenda with CBS 58, and it's for Dr. Weston. She asks, the CDC released new guidance saying fully vaccinated persons who meet criteria will no longer be required to quarantine following an exposure to someone with COVID-19. Does this point to the fact that vaccines may also prevent transmission?
So thanks for the question. It's still not completely clear how much effect the vaccine has on preventing transmission. There was actually this week a promising preliminary research study that came out of Israel that those who are vaccinated have significantly lower viral loads, or the amount of virus in their body, in their system, when exposed to the virus, as opposed to those without the vaccine. And this certainly points to likely far less likelihood for transmission for those who are vaccinated. We'll have to wait for the final research and other research studies to come out probably in the coming weeks as well. And I think the new CDC guidelines suggest confidence in this decreased transmission of people who are fully vaccinated. But it's also supported by previous evidence that people who are asymptomatic, so not symptomatic, but also not pre-symptomatic, so not gonna develop symptoms, but truly asymptomatic throughout the course, as those who are fully vaccinated are expected to be, have less virus in their system and are less likely to transmit COVID. So this transmission related to vaccination is going to be something to keep a close eye on, presuming that the research shows that transmission is far less likely with virus. It would be one of the most promising findings that we've had yet in the pandemic.
I'm seeing a few duplicate questions as it relates to the state data, so I'll ask two questions and combine them. The state has released state and county level data that show Milwaukee is dramatically trailing other counties in the percentage of the county population that has been vaccinated. Why is Milwaukee County trailing, and what more needs to be done to address this? The second question relating to the data is that the data shows that 10.4% of white residents in the state have received at least one dose of vaccine, while only 2.9% of both Black and Latinx residents have received at least one dose. What do you make of this disparity, and what are the next steps you plan to take at a local level to address these issues?
Well, I can spend hours talking about this because I've raised these issues with the state and raised them with the healthcare providers. And I want to go back to the middle of December when we first started getting the vaccines. The first decision that was made, of course, was that the vaccines would go to the health systems. That was the first decision coming out of the gate. My initial reaction to that as it pertained to Milwaukee County was that this is going to put residents of the city of Milwaukee at a distinct disadvantage. And the reason for that is, I think, as we all know, most of the hospital systems have their major presence located outside the city of Milwaukee. All you have to do is look at the county grounds, and that's not a criticism of the county executive or anybody, it's a statement of fact. That's a lot of our healthcare facilities are located outside the city of Milwaukee. Perhaps even more important is a high percentage of those employees live outside the city of Milwaukee, and in a significant percentage even live outside of Milwaukee County. Again, if you look at the location for a lot of our hospital systems, it's not shocking to know that a considerable number of people are going to live in Waukesha County or Washington County or Ozaukee County. So right coming out of the gate, I felt that we were entering into a situation where this was going to put the city at a disadvantage. But it was my hope, and continues to be my hope, that that would be rectified in other areas. But to that first group, again, because all you have to do is look at the workforce for the hospital systems to know that it's more white than it is people of color. The one place where I felt that perhaps we could make inroads here was on home health workers. So on Martin Luther King Day, just coincidentally, and the day after, I made a specific plea for home health workers to come and get vaccinated, because I felt that you would have a lot more diversity in that part of the healthcare system. So that starts out one of the problems. Then you've got the issue that we've seen, for example, that Dane County gets a significantly higher percentage of their population vaccinated than ours. And I've made that case specifically and asked that question to the new head of the Department of Health and Human Services. Why is a higher percentage of Dane County residents, why do a higher percentage of Dane County residents receive these vaccines than we do? The other point that I've been working on locally that I think is significant, and both the state and the federal government have responded to this just in the last 10 days. And we had a meeting I think it was last week, maybe it was 2 weeks ago now, again with the system. And the conversation centered around those health clinics that are located in the community. There are some on the south side, there are some on the north side. Those clinics are far more likely to treat people who live in the city, and they are far more likely to employ people who live in the city. If you're located on South 16th Street or Cesar Chavez Drive, that you're serving the Latinx community. If you're located on Martin Luther King Drive or Lisbon, you're serving the African American community. And so I made the point that we had to get more vaccines to those what are called federally qualified health centers. And the state responded, as did the federal government, because this is not just an issue locally, this is an issue nationally. And so I think clearly what we have to do is get the distribution into the neighborhoods. And so what we are doing in our health department is we're working with churches, we're working with public housing people to make sure that there is an equitable distribution. And what I'm saying here is I want everybody to be treated fairly. I don't want any part of the state, I don't want any part of the metropolitan area, I don't want any part of the county to be at an advantage over other parts. It should be based on who needs it. Right now, of course, we're into the 65 and plus area, but this is something that demands that we have equity. A second issue, and one we're trying to deal with, is that there is some suspicion of the vaccine in some populations. And it's not surprisingly that I've heard from some individuals in the central city who say that they don't trust some of this. And so I think we have to be mindful of that. We have to find people who can engender trust to say, this is safe for you. So there's a lot of work that's being done. Again, I spotted this issue 3 weeks ago. I said, this is a serious concern. I've shared it with the state that this is a problem and we have to address it.
I mean, I couldn't agree with the mayor more. I mean, we've constantly talked about the vaccine hesitation, but also the fact that we haven't been equitably distributing the vaccines. But when you think about why Milwaukee County is trailing, at the end of the day, we need more doses from the federal government to make sure that we're putting the shots in folks' arms. Nobody is hoarding any vaccinations or doses. We're trying to get these shots into folks' arms as quickly as possible and efficient as possible while still following the state and federal guidelines. But when you think about the disparities as it relates to white versus Black and Hispanics getting access to this vaccination, it's pretty disturbing. And we've constantly talked about this. I think everything is on the table. Myself, the Milwaukee County government, we've been working with healthcare systems as well as local health departments to figure out how can we better distribute this vaccination to the folks who absolutely need it. And so, while we don't have a health department, we're going to continue to support the city, support all the local suburban health departments as well, to find a way to equitably distribute this vaccination. But we have to continue to talk about this, if pointed out. I'm glad the question was asked, because we have to make sure that those at the federal level and state level understand that there are people of color who are not getting access to health. And this is playing right into the historical notion of underserved communities not having equitable access to not just healthcare, but whether we're talking education or housing as well.
Thank you both. The next question is a follow-up, Mayor Barrett, to a statement you just made, and it's from Allison Durr with the Milwaukee Journal-Sentinel. She asks, when will the mobile vaccination units be deployed, and do you know what churches it may be going to?
Well, a lot of this is going to be dependent on supply. And again, we know for the next week or 2 weeks, we're not going to get a considerable increase in the supply. And so we've set up the location at the Wisconsin Center. We desperately want to expand beyond that, but we need a critical mass of vaccines really to do that. We can send out excursions, for lack of a better term, with a limited dosage, but in order for us to truly get this into the community, we are going to need a much larger supply than we are receiving right now. And so I know there's another question about FEMA. We've been in conversations about FEMA, but we have to make sure, even with a FEMA site, if we are going to be required to use our own supply of vaccines for a FEMA site, does that move us forward if it's the same level of dosage? So again, what we're trying to do is to make the case that both at the state level and at the federal level, that you have to look at this data. And now the data is there. I'm very thankful that the state has been transparent. I'm sure there's some parts of the state that are very, very pleased. There are others that aren't, but I'll give you an example of one of the challenges. Someone told me yesterday that in the western part of the state, there's a VA center and that they had 2,000 doses and they're looking for people to vaccinate. So my question is, if you've got 2,000 doses that are floating around in an area that's not that densely populated, should the state be sending any additional ones there? Or should they be redirecting them to an area like Milwaukee, where you are seeing this very, very sharp disparity in people of color receiving the vaccines? And I would make the case that throughout the state of Wisconsin, that it has to be a more level playing field. Now, the reality is, I think because there's a shortage, everybody feels that they're being shortchanged. Everybody feels they're shortchanged. And they always look and say, well, he's getting more or she's getting more. I think the role the state has to play is to make sure that there's an equitable distribution. And that's something that I hope and I believe that they're committed to.
As it relates to distribution, Sari Lesk with the Milwaukee Business Journal is asking for clarity on how the vaccine allocations are made. When Walgreens and other vaccinators come on board, do those vaccines come out of the allocation to the region or added locations to an appointment? Or does it increase the number of doses coming into the region?
Yeah, I can take a stab at that to start. It's a great question, Sari. The organization that'd be best poised to answer that question would be the State of Wisconsin Department of Health Services, because they're controlling those allocations based on a formula they have. But broadly, we are told that there's one set of vaccine allocations that's coming to the state. That number has been consistently about 70 to 77,000 doses over the last several weeks. And we continue to believe that it'll be stagnant for the few weeks to come. So out of that 77,000 allocations of doses, comes the vaccine that goes to more community sites. So there is a delicate balance between adding more sites and further diluting the doses that come to our community. But I have seen, the list of Walgreens Walgreens locations. I know of other locations in and around Milwaukee County. And even if they're getting small allocations, it does represent more doses coming into the county to serve the residents of Milwaukee County. So I think it's kind of a plus and a minus. And certainly as we envision larger sites, if the funding of doses, if you will, to those larger sites comes from the same pot of money, I think the state needs to be very strategic and continue to work with us locally on where best to put those allocations.
Thank you, Director Roush. It looks like one more question's coming in through the chat, and it's from Allison Durr with Milwaukee Journal-Sentinel. She says, County Executive, you referenced the county planning to start assisting with vaccinations of vulnerable residents at some point. Can you provide more details regarding the timeline?
I can't provide any real details at this moment. We started those preliminary conversations, but as we continue to figure out what the next steps that we're going to take, I will absolutely make sure to let you know.
Thank you, County Executive. All right. It looks like Matt Smith with WISN is just following up on a question, Mayor Barrett, that you briefly touched on. So I will reread the question. He's curious about the application to become a federal vaccination site. Where would it be located? Has the city county had any contact with FEMA yet? And what is the overall status of that potential?
It's a work in progress. We're continuing to work with FEMA, with the state, with the county to get a site here. But again, I want to stress this. We need additional vaccines with the site. We don't just need the site. We need additional vaccines. And if you look at an analysis of Wisconsin counties, unfortunately, what you're going to see is using health indicators that Milwaukee County generally ranks maybe number 70 or 71 out of the counties in terms of our health status. To have this data come out today that shows that the county that is number 70 or 71 in healthcare status is receiving the 64th highest percentage of vaccinations underscores the disparities that are built into this healthcare system. Here we are coming off a year where the cries have been for equity and racial justice. And I think that we are being tested in real time as to whether we're responding to that. And we simply cannot allow the county that is near the bottom of the list in terms of health to be near the bottom in terms of the number of vaccines we get per person. That is simply not acceptable.
Thank you, Mayor Barrett. At this time, those are all the questions I am seeing. Wait, there might be one more. And the final question from Matt Smith is, can you explain how many vaccines were requested versus how many were received this week?
I can speak for the health department.
Yeah.
I can speak for the health department. I don't know if there's anybody from the health department here. There's two different categories, if you will. There's the second vaccination, and I think it's, and I don't know, Dr. Weston might even know these numbers better than I think it's in the neighborhood of 3,000, maybe give or take 500. And I think the new vaccines are probably in the neighborhood of 2,000, give or take 500. Does that sound right to you, Dr. Weston?
Yeah, I think that sounds about right. And I think, so Director Roush certainly can comment on this as well as the leader of one of the health departments. I think the allocation, so a big question here is allocation versus administration. How much vaccine are we getting? How much are we putting in people's arms? That state website outlines how much vaccine is going into arms. What we don't have great sight on is how much is being delivered to each county, to each institution. I think, and this isn't the fault of the state, this is a national issue, but I think everyone would agree it's not enough. We are ready to put more vaccine into arms as soon as it arrives to us, whether it's the city, whether it's the county site. I don't want to speak for Director Roush, but I'm guessing whether it's Greenfield, everybody's ready to put more vaccine in the arms of people in need, people who are state eligible, as soon as we receive it.
Yeah, absolutely. In Greenfield this week, I'll tell the Greenfield story, then I'll tell you the suburban story of the 10 health departments. In Greenfield for this week, I requested 600 doses and we received only 100 doses. For all 10 suburban health departments, we requested almost 4,000 doses and are only receiving about 1,300 doses. So we're receiving less than a third of the overall request. And that just kind of underscores that the demand is very, very high, but the allocations of vaccine, that supply is very, very low.
Thank you all. There is one final question from Sari Lesk with Milwaukee Business Journal, and it's a follow-up from Mayor Barrett. She asks, what does the state tell you when you raise your concerns about equitable distribution of the vaccine doses?
Well, I can tell you that I felt the state was very, very responsive when I and others raised the question of the community health clinics. And our argument was, look, these are community health centers that are located in underserved areas. The people who live in these neighborhoods trust them. The people who work there are from the neighborhoods. We have to make sure that they have an adequate supply. And I believe that the state changed its distribution model within hours after that conversation to direct more to the community health centers. And I'm extremely grateful to that. I raised the disparity among counties and they said they would do an analysis. The analysis has now come out today and it shows that the arguments we were making are in fact true, that there is a disparity here that's occurring statewide. I know that they have built into their distribution factor a needs formula. And I think that what we're going to see, and I hope this, and I will be on the phone, and I'm sure the county executive will be as well, we are going to make sure that they understand how serious this is for the city of Milwaukee and Milwaukee County. But again, I will give them credit. They responded on the community health centers, and now the need is really there for them to respond on this disparity that you're seeing, the racial disparity and the percentage of residents of Milwaukee County that have been vaccinated. I think they have to respond.
And I would agree with the mayor. You know, when we've had this conversation with the governor's administration, they have been, very responsive to the issues at hand. But at the end of the day, we need to make sure that we're getting the allocation that we need so we can get people who want this shot, their shot. And so, again, we're going to continue to work with the city, work with the state, but we're going to have to develop a much better partnership in making sure that we're getting the types of allocations.
Oh, and one more question here from Emily Files with WUWM. She says, you mentioned Dane County having a higher rate of vaccination than Milwaukee. Do you attribute that entirely to disproportionate distribution of vaccine by the state?
Well, again, this issue I have raised specifically, and I'll tell you the response that we've received is that there's a lot of healthcare in Dane County. So you're going to have, in the first group going through, you're going to have a lot more people who work for healthcare who live in Dane County who are going to receive that. Again, when you draw an analogy to southeastern Wisconsin, the healthcare systems are located primarily outside of the city, and a significant portion of their workforce is located outside the county. And so in Dane County, it's more hyper concentrated in Dane County. In southeastern Wisconsin, you're going to have a lot more workers that work in healthcare in Milwaukee County, but don't live in Milwaukee County. And so I think it's important for us to do that. But I don't want to get hung up on what happened 4 weeks or 3 weeks or 2 weeks ago. I want them to look at the numbers now, and I want them to readjust the distribution formula now moving forward. Because the other fact of the matter is, and you look at the economic stratification of southeastern Wisconsin, which county is going to have the most essential workers? I think without a doubt, the people who are working in the restaurants, the people who are working in the grocery stores, the people who are working in the lower income jobs that are interfacing with the public, demographically, they're more likely to be living in Milwaukee, in the city of Milwaukee in particular. And so it's imperative that we make sure we're serving them as well.
All right, I'll check the chat for one final question. All right, I think that concludes our briefing for today. Thank you all for joining. Have a nice weekend and we'll see you next week.
Thanks, everyone.
Much.
Thank you.
Thank you.